now we have two final questions open Q&A from the audience. And the first question will come from Denny.
Yep. Hi, I'm Denny Schneider, Big Action Leader in the Woodbury area. If federal health care reform really does pass, I guess a lot will depend on the results in Massachusetts tonight, it will still leave many gaps in both coverage and affordability and a lot of issues. As governor, how would you lead to develop a plan, and how would you gain necessary political and popular support for health care for all Minnesotans? What would your plan look like? And would you support a single-payer plan, such as the Minnesota Health Plan?
If the Minnesota plan came through the legislature, I would absolutely sign it. But I think we're going to have to learn from this whole experience and come back with something that not only builds on whatever comes out of the federal level, and at this moment I can't frankly tell you what it'll be, but also moves dramatically beyond that, and also gets at a couple issues that have not been dealt with at all, which is far more preventive work and far more cost containment. When I say cost containment, I'm not talking about denying people coverage. I'm talking about taking money out of things that don't make people healthier and putting it into more universal coverage. Here's a couple of the values that I think are important. I think immediacy needs to be put into this discussion. So much of this discussion has been about what we do 10 and 20 years down, and that's a really good thing, but every year that we lose kids, not fully covered. Every year we don't get universal coverage, we have huge challenges. And as a mayor who is proud to fund school-based clinics, I'm a big believer in preventive care. So I think we need to move immediately towards something that goes way beyond the federal level on universal care for children, and then keep going up the age group as quickly as we can on that. We need to win back the issue of cost containment in this, because one of the reasons politically this has been a problem is we haven't made that case. Great book, Healing of America, talks about all of the health systems in the world, lots of different ways to do it. In France, however, good example. When you go to a doctor's office, you're swiping your debit card, all your information is there. That saves millions of dollars from all the records we have. That's one example. More important would be care. I really want us to get more preventive care that gets to nurse practitioners and community-based clinics instead of highly compensated professionals for relatively low cost issues. And if you do that, you can take some of those dollars and put it directly back into where it belongs. I also believe that we need to reintroduce into this discussion the issue of preventive work and health and responsibility. I think the food issue is a big part of this issue. I think the issue of how we exercise is a part of it. And I think we can package that all together in a way that is much more aggressive than the federal level, but also brings people along better.
And our final question from Ryan.
Hi, Eric. I'm Ryan Hurd. I'm a Big Action Minnesota member and active participant in the reNEW Minnesota campaign. There is a large number of minority students in our public schools, and in many schools, the minority may certainly be the majority. Nevertheless, the achievement gap between students is wider than ever. What, as governor, will you do to make sure that there is no achievement gap and that Minnesota improves its public education for all students?
Well, as I said earlier, I will bring far more hands-on experience with communities of color, and especially with addressing achievement gaps, than any governor we have had, period. And I think that's important. I've got a lot to learn, but I've seen a lot as well. And I think a couple things are important. One is the achievement gaps cannot be considered something that is, gee, too bad, or not a good thing. It is absolutely undemocratic, un-Minnesotan, and intolerable, and it has to take aggressive, serious action. Now, I don't just say those as words. I stood up with a superintendent who's taken very tough action. I've been booed down in community meetings and people have disagreed with the direction, but I've been willing to take tough actions. And I'm really proud that when you can walk into Lucy Laney School or Nellie Stone Johnson in North Minneapolis or City View, the education is better than it used to be, but boy, does it need to go further. So a few things need to happen. And by the way, the mayor of Minneapolis has no direct authority over schools, but I've become deeply involved in it. One of the reasons I want to be governor is because I want so much to work on these issues. And I'm trying to do this in 1 minute. Bear with me. A couple things need to happen. First is in the schools themselves. We need to recognize that the very narrow constraints that we put on how we test kids do not test the full brain, and especially the full brain of kids who cross multiple different community platforms. So we need to stop the No Child Left Behind narrow way of measuring and look at lots of ways of doing it. Quick example. I learned from working in North Minneapolis that one of the key ways to open up kids who were failing in math was to introduce them to music, which crosses different parts of the brain and begins to open kids up to that. So the work that the district did, that I supported at the high school, the elementaries I talked to, all introduces music into the curriculum. If you want engineers who are kids of color, you'll also make sure that you have non-traditional pieces. I'm looking at seeing Peggy Flanagan back there who helped lead that work, who took tough votes, and thank you for that leadership there, Peggy, in doing it. The second thing we have, there is so much more I want to Give me 4 minutes to talk